Okay, not too sure, Dr.
Some
Yes,
people
ma'am.
are saying it's not opening from their end. 3 people have
The
called.
YouTube? I
No,
just
no, no,
started
the
live
Zoom.
streaming. The Zoom.
Zoom.
Well,
Check
I
on
don't know
your
what's going to happen because we all
Yes,
checked.
are saying it's not opening from their end. 3 people have
The
called.
YouTube? I
No,
just
no, no,
started
the
live
Zoom.
streaming. The Zoom.
Zoom.
Well, I don't know what's going to happen because we all
Yes,
checked.
are saying it's not opening from their end. 3 people have
The
called.
YouTube? I
No,
just
no, no,
started
the
live
Zoom.
Okay. How you need to mute the Zoom, I mean the YouTube, so that the interference from YouTube is not coming in. You know what?
Well, I've muted it.
Great.
So, Dr. Onojuko, you can start off. The session. Please welcome, please.
Please, can we start?
Please go ahead and start. Our Dr. Onojuko is not joined yet.
Hello. So good evening all. Welcome to another monthly webinar for Nigerian Association of Dermatology. So today we have a community webinar that is co-sponsored or in partnership with La Roche-Posay. So we'll be having two speakers that will be talking on the topic increasing awareness of hyperpigmentation and sun protection in skin of color. So we have two amazing speakers that will be talking on this topic, and then followed by a product presentation by La Roche-Posay by Anne-Sophie. So I'll just go ahead to introduce our speakers for today, and then we'll take those presentations followed by Q&A, then we'll take the product presentation. So our first speaker is Dr. Olufemi Cole Adefe, who is a consultant physician. She's a dermatologist as well as venerologist with the Department of Internal Medicine at the Lagos State University Teaching Hospital in Ikeja. She's also an associate lecturer with the Lagos State University. She's a graduate of the same college. She's an active clinical researcher working on various aspects of clinical research in medicine, as well as dermatology, as well as public health. And she's a skin health advocate and frequently engages as well as educates the public about good skin health practices, as well as the dangers of skin lightening on radio, television, and various social media handles. And she also talks about, she has passion about talking to the public about dangers of skin lightening. So these are some of her active roles, both on social media as well as other forms of broadcasting media. She was recently awarded in 2024 the La Roche-Posay International Grant for the African region for albinism research and the 2025 Young Dermatologist International Achievement Award for the African region. So, of course, who better than to talk about this topic? So we'll start by hearing her, and then we'll introduce the next speaker so that we'll not forget her own bio when she comes to start speaking. So, Dr. Cole, over to you. You can start sharing your slides so that we can start hearing you. Our time has well gone.
Okay, however, actually, it's hyperpigmentation first.
Okay.
Then the sunscreen will follow. Yes.
Okay. So
that was the way they wanted it. So we didn't want to interrupt you. So just
okay. So Doctor, so you're going in first?
Yes.
Okay, so the first speaker will be Dr. Aisha Ekunkube, who is also a vice president, and she's an associate professor with the Lagos, sorry, I'm just trying to get this. He's an associate professor of dermatology and genitourinary medicine at the College of Medicine, also University of Lagos, and a consultant dermatologist with several years of clinical as well as academic and research experience. And she is also a lecturer and a trainer, and she mentors as well as trains young dermatologists in the field of dermatology. Her interests are neglected tropical diseases, hair disorders, community dermatology, quality of life infectious dermatosis, as well as the effects of skin bleaching in in skin of color, photo protection, as well as dermatological care in pigmented skin. She is a founding member of the inaugural executive committee of the African Society of Dermatology as well as Venereology, that's ASDV, and she has contributed to the society's foundation and direction from inception. So, Dr. Akinkubi, over to you before Dr. Cole takes over. So, she has started sharing her side. So, let's listen attentively. I'm very sure we'll benefit a lot from these presentations. Thank you.
Thank you very much, Dr. Hawa. So good evening, good afternoon, depending on where you're joining from. So I'm just going to go straight to it. So it is a community webinar whereby we're trying to reach the community. So it's not directed primarily at us, it's directed at the community, which is the general public, our nurses, our pharmacists, other healthcare providers, and general physicians. So I've been speakers for both BioStuff and L'Oreal. Those are my conflicts of interest. So this is the outline that I'm going to follow. So we know that pigmentation is the natural color of the skin, and this is determined by melanin. While hyperpigmentation itself is a condition where you have certain areas of the skin becoming darker as a result of an excess or an overproduction of melanin as a result of a skin condition, of which I will highlight the various causes. It occurs anywhere on the body, often the face, but we also have the hands, the shoulders, and other body parts that are affected with the inflammatory process that is ongoing. But it's important to know that dark skin types show hyperpigmentation more easily and more visibly. In our environment, this is directed to Africa and Nigeria in particular, we have multifactorial reasons why the approach to pigmentation is worse. We have cultural practices, we have weak regulation, social, psychological factors, and then of course, gaps in healthcare access and awareness, which is why we're bringing this to the fore in the community so that the other people on the task shifting process of getting access to care are also brought up to speed. There is a high psychosocial and economic burden. It affects their quality of life, and this is very, very important. So globally, 231.2 million people are affected with acne, and acne is one of the most common causes of hyperpigmentation. You have 1% of the general population having melasma, and it is common in women of reproductive age. But these things are more persistent in darker skin tones, which are the phototypes of Fitzpatrick 4 to 6, which are what we find in our environment. But post-inflammatory hyperpigmentation disproportionately affects this demographic. So I'm just going to briefly talk about the pathophysiology just so that it explains what's going on. So there's inflammation, which contributes to the damage of the basal cell layer and the epidermis. And this is what acts as a trigger for the melanocytes, and it releases the melanosomes, which contain the pigment to the surrounding cells. Then you now have abnormal and excessive pigment deposition. And we have melanin existing in two forms. So you have your eumelanin and you have your phenylalanine. Your eumelanin is what provides photoprotection because it absorbs your ultraviolet radiation and it neutralizes free radicals. So when there's a skin condition, you have chronic stimulation. And so there is persistent pigment deposition. And as a result, the degradation is slower and it gives you the pigmentation, which now becomes more persistent. And as I mentioned earlier, we are more prone. So this is just a schematic just to show you. So you have your trigger, you have your skin inflammation or your injury, there's melanocyte activation, and then you have your increased melanin production, and then the pigment is transferred to the keratinocytes, and that's what gives you your visible dark patch. So there are various types of hyperpigmentation. You have age spots and aging, exogenous or chronosis, which is as a result of excessive use and abuse of topical corticosteroids, potent ones for that matter, as well as skin bleaching using hydroquinone. We have freckles, we have melasma. So there's a wide range of things. Your freckles, which is, what you're actually, it's genetic, it's what you're born with, melasma. Then you have your PIH, which is your post-inflammatory hyperpigmentation. You have acanthosis, you have your hormonal influences, you have drugs, you have sun-induced reasons, and then malignancies, which is also quite an important thing to find. So I've just put these down here. I would pick on the hormonals, pregnancy, oral contraceptive pills, medications are very important. So even when you're approaching a person with hyperpigmentation, it's important to know what drugs they're taking. And then you have your systemic conditions, which I have listed. So for post-inflammatory hyperpigmentation, I'll give this a little bit more of a focus because it is commonly what people are bothered about because of the way the pigmentation is all over their body and following a skin condition, which could be inflammatory like lichen planus, psoriasis, or any of the others that I earlier mentioned. So causes I've mentioned, intrinsic or extrinsic, but its cause is chronic and unpredictable. For some people, it's very bad, and for some others, it isn't. But the resulting post-inflammatory hyperpigmentation that results, it can actually be prevented or alleviated, particularly when the person is diagnosed on time. So prompt diagnosis, proper diagnosis, and then intervention at the right time by being treated. Your underlying inflammatory conditions should be looked for. So what we're trying to do is create awareness so that, when you have a skin condition, it's not going away. You need to try and find out what the cause is. So as we're addressing the nurses, the pharmacists, other healthcare providers, this is important. So PIH versus hyperpigmentation. Here are some images, and these are other conditions where you can see the top left is where we've had a condition, cutaneous T-cell lymphoma resulting in hyperpigmentation. At the bottom, you can see atopic dermatitis. These are just other inflammatory conditions that give you post-inflammatory hyperpigmentation. And then, of course, we can't go without mentioning the effect of hyperpigmentation from the excessive use of potent topical corticosteroids. So you have dyspigmentation, you have erythema, and then we have what we call the roasted plantain sign anyway here, where the knuckles are hyperpigmented as a result of these patients. Then we have hyperpigmentation of other parts of the body. This is really important. It's gaining more awareness because, social media, the effect of social media, everybody's bothered. The underarms, between the thighs, areas where there's friction. You can see here, this is a medical condition. We have acanthosis nigricans, the back of the neck. You can see it's smooth, velvety, very dark. So this is not something that you want to, if someone presents to you, shows you your sister in the community or someone that you see, it's not something that you want to go and start treating with things. This is someone that needs to benefit from seeing the dermatologist or even seeing the GP who can subsequently refer because you need to identify it as a systemic condition. And then here again, you can see there's other types of, we have periorbital hyperpigmentation, which you can find in atopic dermatitis, younger individuals, adults, but then you also have it as a result of friction, as a result of irritation sometimes, and it is very obvious, and a lot of people present seeking help for this. Chronic friction on the thighs, commonly in our environment, there's a lot of hot and sweaty, the kind of clothes we wear also. And then in the armpits too, apart from acanthosis nigricans, you have friction from some of the clothes we wear. There's heat, there's sweat, and so there's friction, when they wear tight nylon clothing that hamper the armpits. So the 5 whys of hyperpigmentation, I just kind of put this here. Why is the skin dark? Because it's got increased melanin production. Why is melanin increased? Because of inflammation, hormonal changes, even sun exposure. Why is there inflammation? I think I've already mentioned this. Why did the trigger happen or get worse? Possibly because there's delayed or no treatment for the skin condition. There's use of harsh skincare products, overuse of the topical corticosteroids or bleaching products, lack of sun protection, self-medication without proper guidance. Why is it still persisting? Well, people are not protecting themselves. So there's continued sun exposure despite the fact that you have hyperpigmentation. There could be ongoing skin irritation or repeated injury, incorrect or incomplete treatment, and then continued use of harmful skincare products. So this is just a feedback from colleagues when we're talking about hyperpigmentation and what do they feel that their clients, or the patients, in fact, want. They want affordable and accessible treatments, newer and safer depigmenting agents, patients using many products so they're not reapplying sunscreen. We need new body post-inflammatory hyperpigmentation. So at the end of the day, this was just an informal question that I asked, to my colleagues, and this was what came back. So enough of us are seeing patients with hyperpigmentation. So it's important that we are aware about hyperpigmentation and we know what we can do. Of course, there's lack of knowledge. There's TikTok doctors with the various 10-step care regimes. So what can you do? You should be able to identify what is causing. Is it acne? Is it eczema? Is it skin bleaching? Is it sun? Is it medications? Rule out your steroid abuse. Ask about the duration, so you want to know how long you've been having it. Advise stopping all irritating products. And then no matter what, we always want to encourage just gentle skincare, no actives and sunscreen use. So avoid harsh scrubs, lemon toothpaste. There's so many things that people in the community do. Applying onion peel, brake oil, engine oil. There's so many things that people do in a bid to solve an inflammatory process that is ongoing. Then we also want to reinforce realistic timelines, weeks to months, for this. Importantly, we must be careful of social media. This is very, very important. The generation that we see and that forms the bulk of the young people in our environment, first thing they do is go to TikTok or go to X or go to Instagram. And those doctors advise them what to do. And they take that first. And then when they hit problems, then they come to the dermatologist. So we need to, as we're speaking to the community, we're also trying to say, look, use your social media, do your internet research, but with caution. You can't verify who you're dealing with and what information is coming to you and what you're doing. If you hit a brick wall, or when you do hit a brick wall, then you really do need to see a dermatologist. But remember that the doctor's social media is not a doctor, so it's advised. So while we go on to management now, I just put up this because this is one of the commonest, as I have earlier alluded to. So how do we all want to deal with this? The general public. If you have acne, we want to start addressing it early. I know that, I have some people who come in and they will say, my mom just says it's a rite of passage, but it's affecting me, mommy. And my mom is not taking any paying any attention to it. So we do need to, we're trying to say we must treat acne early. We don't want them to get to the hyperpigmentation. We don't want their quality of life affected. So in the community, we must seek out treating acne. Avoid scratching, avoid picking, avoid squeezing. Introduce the skincare products gradually. Don't use too many things. Too much can be excessive. There's cross reaction, there's irritation, and then you don't know what you're doing. Keep it simple. Seek medical care for your hyperpigmentation when it becomes, persistent. Only use depigmenting pigmentation products that are common and prescribed and recommended by dermatologists. On the don't sides, we don't want triple action creams. We don't want skin lightening, skin bleaching. Don't ignore a persistent rash. Avoid scratching. Beware of advice on social media, and don't stay in your corner. Seek help and find the help of a dermatologist or doctor. So if you're a nurse listening here, what should you do? Patient education. You want to talk about these things too. You want to talk about how they should prevent hyperpigmentation. You want to reinforce drug adherence. And same thing as well. You want to promote simple and gentle skincare routines and regimen. Encourage some protection, and I'm not going to talk about that because second speaker, that's where she's going to be talking about. Avoid skin lightening and bleaching products. Educate patients on realistic timelines. People come in and they've got hyperpigmentation and they want it to go immediately. It can't. So it starts from the beginning. If you don't start to give them that confidence at the beginning of what to expect, then you find that 2-3 weeks down the line, they're going somewhere else. They're going to try something else. They're hopping from one healthcare provider to another, because in the healthcare provider ecosystem that we have in Nigeria, that includes your church, your mosque, your family, the pharmacy, the nurse, the GP, and then finally the doctor. When they get to us, it's too late. So we all want us to be aware and try and step in and help people rather than worsen the situation. Then we don't want you describing every rash as simply a skin lesion. Don't assume all conditions are allergies. That's another thing that we get. Oh, I've got allergies, or it's allergies. And then because of that, they're following the path of allergies, and it's a misdiagnosis, it's the wrong diagnosis, and as such, they don't get to get the right treatment. Don't advise triple action creams or any of these unproven home remedies. As a pharmacist, well, your job is to counsel on proper medication use. You should be able to recognize and treat common fungal infections. And the Nigerian Association of Dermatologists has had several, particularly when we have our conferences in Lagos, we've had several trainings because we recognize the need for the pharmacists to recognize and treat these common fungal and other type of bacterial infections as well, that people from the community will come to them. And we have a very good relationship, and we've had a lot of trainings, and there is a collaboration and a referral system. So this needs to be, continued, and we should increase the ante, in all parts of Nigeria. We want to screen for harmful skin lightening practices. We should tell them. A lot of pharmacies, my next sentence might be controversial, but it's just the truth. A lot of these pharmacies also sell these products, which are harmful to us. We should also educate on realistic timelines. Don't just, when you're selling a product to them, remember they bought a depigmenting over-the-counter drug, and they come to you, and so there should be a little bit of counseling that goes with it, because they believe they've bought this drug and then they're going to go home, and in fact, they're going to wake up the next morning and your hyperpigmentation is gone. So if you start by even just having that awareness with them and educating them, you see that their expectations are more realistic. And then when it is persistent, current, or it's unusual, even when you see it, you should be able to say, this is something that needs to be referred. And as I said, we have a very good relationship, and we want this to continue, whereby patients are referred so that at the end of the day, they get the best care. Don't dispense potent steroid creams indiscriminately. So we have our potent steroid creams, which we need to use for inflammatory conditions, but it's being used indiscriminately. So they should be advised about the side effects, advised how to use it, spend time rather than just, dispensing it. And that is what happens at many of the bigger teaching hospitals and pharmacies. Don't recommend triple action creams, and don't encourage prolonged use of these things. So as a general practitioner, well, we should be able to recognize and treat common dermatologic conditions, because when the condition is promptly recognized and treated, the likelihood of the hyperpigmentation and the inflammatory process is intercepted, and so the pigmentation is less. We need to train and retrain ourselves. Prioritize prevention at visits, so you can talk, you can counsel. You should screen also for harm. You should see them and tell them that these products that they're using are not good. You should look out for red flags and alternative diagnosis, particularly when patient is coming back to you and has not gotten any better, and set your expectations early. We have relationships, so we refer. You shouldn't miss a fixed drug eruption. You shouldn't miss a severe drug reaction. You should recognize this. You see some people having fixed drug eruptions and they're still trying to use topical potent steroids on this. Don't use triple action creams, and don't treat the rashes empirically. So our management principles, you need to identify and remove the trigger, whatever that may be. Sun protection, skin barrier repair, and evidence-based actives. And we must be consistent over months. It's not going to change just like that. You need to counsel, educate, and manage expectations. So if you have a patient and, this is how we should approach it. I've already talked about the duration, advise stopping all irritating products immediately when you find out what they're doing, encourage gentle skincare, sunscreen use, and avoid these harsh products. There are a lot of organic, so organic is also being used indiscriminately, because organic is meant to be all natural. But, some of these things don't even have a NAFDAC certification, and they don't even have their products listed. We should reinforce realistic timelines. So we have pharmaceuticals, we have procedures and devices, and we have dermocosmetics. There are topical agents that target, the melanin production, which I mentioned earlier, skin renewal, inflammation, and then some of them are combination treatments. We also have chemical peels. These are things that are done by the dermatologist. And we have our dermocosmetics, which are a lot of agents that are available over the counter that can help with hyperpigmentation. So we have azelaic acid, all the various things I've listed. Then we have prescription-only products, which should be with a prescription from the doctor. Then what else do we want to do? We want to ensure that we use retinoids for acne-related post-inflammatory hyperpigmentation. Tretinoin cream can be used, and it should be used with sunscreen. Moisturizers will reduce your irritant dermatitis. We don't want, I've mentioned this already. So safety concerns, hydroquinone misuse. That's what we want to, highlight here, that there is a lot of hydroquinone misuse. There's retinoid irritation. So when you're even prescribing the retinoid, you want to know that, okay, you start from a point 0.25% and then step up. But more importantly, tell them that there could be a bit of dryness. And you still have to tell them just a pea-sized amount should be used. So a lot of them feel that, oh, this medicine is good, doctor has prescribed it, and then they rub it generously over the face. And so there's a lot of irritation. We have photosensitivity, and we must bear in mind avoiding retinoids in pregnancy. It's not moving. Hold on, sorry. Okay, so what are the challenges that we face while we have this hyperpigmentation? Social media, mainstream media, misinformation and mismanagement. Unfortunately, it's the area that we're in. So we all need to step up and, get ourselves into that space so that you're giving correct information. The mainstream media needs to support
for
us
palliative, and then I'll do my waiver job. That sounds.
A big challenge is.
Please, let's kindly mute ourselves.
Then 3 years of waiver job.
A big challenge is non-recognition of the cause of
You've never seen a beautiful woman before?
Could you please
You have never seen a
mute
beautiful
yourself?
woman before?
Thank you.
Really? Not as beautiful as me, right?
Please, can we mute?
Okay. So misinformation and mismanagement. This is key because the social media is giving you loads of information. So it's information overload and not necessarily by the experts. And it's for that demographic, it's just what they can find. And they're ready to do the 10-step routine, the 7-step routine, and all of those various things that are going on. Address the preventable cause of hyperpigmentation. We need to stop the use of indiscriminate potent topical corticosteroids and also our triple action creams. And then access to dermatologists granted can be limiting because we don't have enough for the 250 million people that are out there. However, we have dermatologists in every state. We have several in the main cities, Lagos, Abuja, Port Harcourt, Enugu, Kaduna. So we need to, as a community, both from the people in the community, the nurses, the doctors, the pharmacists, we need to also have that referral, reach out and have a dermatologist that you can reach, that you should know of, so that when you get into a situation where you identify something and there's a problem, you are even giving them, oh, please, I need you to go and see the dermatologist, so and so in the teaching hospital or, whatever public or private hospital near you. This is key because you have provided a complete solution to what has been going on, particularly if you have been treating the person or the person has been coming to you and you've given some medications and things like that. You need to intervene at the right point. And that is why we are trying to increase the awareness of hyperpigmentation in the community, but more especially in the people whom the community will go to, because you're all part of this ecosystem that provides healthcare. So in conclusion, hyperpigmentation is a significant cosmetic and psychosocial issue. It adversely affects quality of life by impairing their self-esteem and social functioning. And still going back to, generations, young.
Dr. Quinkube, I'm not too sure we're hearing you. Okay, I think we lost her. Sorry, we stopped hearing you for some time and we can no longer see your slides.
Yes, I don't know what happened. I think the network just went off. Let me finish. Here we go. Okay. I think you can see my slides. Yeah. So I was talking about the quality of life that is really very important. Self-esteem. You have the young generation coming in, and the middle-aged generation don't recognize this, but social media and the information and technology age currently is affecting their psyche. So prevention and early intervention can mitigate this long-term impact. Access to dermatologist care is still limited, but it is accepted that it is a challenge, but where it exists, definitely use it. IEC, that's our information, education, and counseling. Our awareness campaigns should be non-stop and they should be consistent. And I think on that note, I'd like to say thank you very much. And please put any questions you have in the chat. Thank you.
Thank you so much, Dr. Kinkibe, for a wonderful presentation. So I think we don't really have much time, so maybe Dr. Cole will take her own before we take questions and answers before the product presentation. So Dr. Cole, so you have plenty of claps and loves and kisses coming up for Dr. Kinkibe. Dr. Cole, we're ready when you are. Dr. Cole, are you still with us? Please, can we be dropping our questions so that when the question and answer time comes, we can just read most of them to save time? Okay, I'm not too sure what is happening to Dr. Cole.
Okay. Yeah, Dr. Cole is just trying to log in.
Okay.
Just acting together. Okay, maybe you can just take one or two questions.
Well, I'm not too sure I've seen any questions so far in the chat box. There's no question here. I'm not too sure I've seen questions on. Okay. Okay, the only question I can see here on YouTube is they didn't hear any mention of licensed estheticians. Does this mean only dermatologists can handle skin concerns? Then there's another one. I believe health professionals need intentionally invade the social media space. We have an impending pandemic if this is not done. So I think this is more of a comment. Dr. Akinkube?
Yes, thank you very much. Yeah, we have licensed estheticians and aesthetic physicians as well. They are also people that treat hyperpigmentation. I didn't focus on them because once you're an aesthetic physician, it means you're also well trained. The whole idea of the community webinar was the focus was to get to the community. But yes, well-trained aesthetic physicians are aware of how to treat pigmentation, and they also know where the limitations are and relate and have a relationship with the dermatologist generally. The social media aspect is out there, and I talked about regulation. You have people that are not that are not aestheticians qualified, so this is very important, and they're the ones that will give you, you can have problems with them. So as the general public, if you're not getting any satisfactory treatment, then you should seek help with a specialist and step it up.
Okay, thank you very much for that. Somebody mentioned, Dr. Cole, we're still waiting for you. Somebody mentioned what's the best product for pediatric hyperpigmentation on the laps occurring from birth?
So I think first things first is to try and find out what exactly is going on. I usually you have to allow things to heal. So if if there is an identified skin disorder, you want to allow the process to get better on its own. But if it is something that is, like for instance, atopic dermatitis, you want to use topical corticosteroids, but start mild. You did say in an infant, sorry,
No,
because
he said from birth. The question actually mentioned from birth,
from
occurring on
birth.
the labs from birth. So maybe a form of
No, then
nevus
that
or
is
something like
that's
that.
a nevus. Sorry,
Yeah.
I missed from birth when you said child. No, that is a nevus. If it is from birth, then that is not the only other thing to do would be laser. May I just ask Dr. Hawa, can you just go on? Let me help Dr. Cole. Her internet is not going. That's why she needs to use mine. Just hold on a minute.
Okay, I think those are the main questions on the YouTube channel. Well, I don't know. Maybe we'll just discuss what for those of us that joined in late. For those that joined in late, sorry, not those of us. Dr. Kunkube spoke about hyperpigmentation in general. She introduced the concept of pigmentation, what causes hyperpigmentation, and globally, she mentioned about 231 million people were affected by it, whether it was from post-inflammatory disorders or medications or whatever it is, hormonal changes. So she mentioned quite a lot of things that were responsible for hyperpigmentation. And she also took us through the pathophysiology, the inflammatory processes, abnormal excessive pigmentation, deposition, chronic inflammations. And after that, she went through the different types of hyperpigmentation following inflammatory processes, hormonal changes, following some medications, exogenous causes of hyperpigmentation, and also other systemic diseases or illnesses that can lead to hyperpigmentation in certain areas of the skin. And she mentioned the different parts of hyperpigmentation, those occurring on the face, those occurring in other parts of the body, and she showed us a lot of clinical pictures and examples of all these things. Top among the list, especially for us here in our environment, she mentioned acne, those following eczema, melasma, and so many other clinical skin conditions. Of course, we also know bleaching causing exogenous ochronosis and so many other types of hyperpigmentation. So bleaching was also mentioned there as part of side effects of bleaching. And then she mentioned the 5 whys of hyperpigmentation, and of course she told us about some feedbacks she gets from patients as well as some other physicians or her students. So those things were also mentioned. And then for tips as to what we can do to actually prevent or reduce the effect or reduce hyperpigmentation, I'm talking about identifying triggers early and also managing them early. She spoke about reducing the effects of steroid abuse, both for physicians as well as those that are taking them over the counter. And generally, she advised about social media advice, especially for the young generation, where almost every advice is gotten from social media before you actually get across to the health professionals. She gave several advices, both for the general public, how to well, if you have a rash, you actually need to seek proper advice properly. And she spoke about especially with acne, where you need to get advice early other than just disregarding such complaints. And then she spoke about several other things that we needed to do to avoid scratching, introduce skincare gradually. Okay, we're coming up, but let me just round up. So she gave advice for general public, advice to the nurses, the pharmacists that dispense these medications, advice to other general practitioners, as of course she advised training and retraining of ourselves to identify and remove trigger factors, and then skin protection should be top on the list. She mentioned some of the challenges that we face in our environment, especially with social media as well as mainstream media. Important or the proper information needs to get out there, okay? And then she mentioned other things like address preventable causes of hyperpigmentation. to stop indiscriminate use of topical corticosteroids, stop the application of topical action creams, and then, of course, access to dermatology. She mentioned places where they have a lot of dermatologists. Teledermatology as well as telemedicine, it's actually taking up, well, it's coming up in Nigeria in particular, and there's some people that are actually doing that. Where you don't have access to that, of course, these are other options or avenues you can get across to them. And she concluded by saying hyperpigmentation had a significant cosmetic as well as psychosocial effect on individuals. It also reduces the quality of life in a lot of individuals. So part of the advice was to prevent, and for prevention as well as early intervention when such issues arise. And then, of course, refer for the general practitioners, the pharmacists, the nurses seeing these other patients to refer them to get specialist care early in the course of the disease before permanent damage or long-term damage has actually been done. So I think Dr. Cole is with us now. So maybe I'll give her away. I just decided to summarize while we're waiting because we did not really have many questions on board. Okay, there are some questions, but I think we'll wait for Dr. Cole to finish so that we can take the other parts of the questions for Dr. Akinkubi. So Dr. Cole, I think you have the floor, even though I've stopped seeing your slides. I don't know whether you can start sharing. Dr. Cole, are you with us? So I don't know what is happening. Dr. Cole, are you with us? Dr. Cole is supposed to take us through the use of sunscreens before we take the product presentation. Dr. Cole?
Yes, hello. I'm so sorry. Good afternoon, everyone. Just having some network challenges. Can you see my slides?
Yes, we can.
Okay, thank you very much. And good evening, everyone on the call. I'll just go right into it. I'm going to be talking about sun protection in skin of color. I've received a grant, as mentioned earlier, my conflict of interest, and I'll be talking about the role of sun protection in melanin-rich skin and, you know, the unique factors we have in Nigeria and Africa, as well as the importance of photoprotection or sun protection for managing hyperpigmentation, photoaging, and skin bleaching practices. So why do we need photoprotection? So as we know, the sun emits various rays of various wavelengths, including UV, ultraviolet radiation, visible light, infrared radiation. And ultraviolet radiation is not all bad. It has very beneficial effects for us as humans. Vitamin D activation, it helps with our mood, but it can have detrimental effects in excessive amounts, photo damage, what we call photo damage of the skin. And prolonged UVR exposure can lead to skin aging, premature skin aging, dyspigmentation, that's hypo or dark spots, hyper or dark spots, hypo or light spots, and skin cancers. And the purpose of sun protection is to minimize the unwanted effects of the sun without losing the benefit. So we must always try to find that balance. So the the main UV ultraviolet radiation that hits the earth, we have UVA, B, and C, but UVC is blocked out. UVA and B are those that hit the earth, and you know, UVA is longer than UVB and actually penetrates deeper into the skin, particularly long UVA1, which gets all the way deep into the dermis, and it tends to, cause more premature aging and hyperpigmentation. UVB tends to, be a bit more superficial, and it's more associated with sunburn and all. And it's also UVB is more common, or you have more UVB on the hot or the high intensity periods of the day, 10 a.m. to 3 p.m., while UVA is present all year round. And so the effects of ultraviolet radiation on the skin include oxidative stress. It can damage collagen and elastin, can cause photoaging and wrinkles, and in excessive amounts can cause immunosuppression. Of course, in controlled, healthy amounts, it's beneficial to the skin and general well-being, as we've said. And then we also have the visible light, which we have recently come to understand that is also important or contributes to hyperpigmentation particularly in darker skin tones. So UVA is associated with melanogenesis and increased pigmentation, so hyperpigmentation, uneven skin tone, and in lighter skin types can lead to DNA mutations that can eventually lead to skin cancers. Now, there used to be some people saying UVB only causes sunburn, but that's not true. Both UVA and UVB can lead to sunburn, and both UVA and UVB can lead to photoaging, but UVA more than UVB. And then DNA damage and skin cancer is caused by both UVA and UVB, more of UVB. So the awareness of sun protection has increased in recent times, and there's increased awareness, particularly due to social media. I mean, this is one area where social media has actually been a bit beneficial, although there are a lot of now controversies about the safety of sunscreen. But social media has helped people to be aware of the fact that they need to, photo protect, and I'll talk about that a little bit later. And there's also rising incidence of ultraviolet radiation-induced skin cancers among Caucasians and in this part of the world among people with albinism. However, most people, dark-skinned people, are not practicing, sun photoprotection, and that's okay because we believe we have enough melanin popping, our melanin is doing a good job, which it is actually, but it's not a complete or sufficient job. Now, sun protection is not just about sunscreen, and that's one thing we need to note. It involves sun avoidance during the peak hours of the day, usually when the UV intensity is highest, 10 a.m. to 3 p.m., wearing protective clothing, long sleeve clothing, trousers, wearing wide brim hats, seeking shade whenever possible, like under a tree or in the house, using UV protection glasses, umbrellas, and then sunscreen. So all these form parts of sun-safe and sun-smart behaviors that we advise. Now, what is UV intensity or UV index? We measure the UV intensity or UV index by a measurement of how much ultraviolet radiation is present at a particular place and time that can cause sunburn. And this varies based on geographic location and latitudes. Its UV index is usually higher in the tropics and lowest in the polar region, so in the northern and southern extremities. And it represents the risk of sunburn. So in this so you can see 1 to 2 is low, and then you have up to 12, which is extreme. You have moderate, you have high, you have very high, and you have extreme, as you can see in this slide. Now in Nigeria, our UV index is consistently high to extreme. So it's usually around between 7, and on a very hot day, it gets up to 11 or 12. And this is the same for most parts of Nigeria, where we have the dry and rainy seasons, and we have even semi-arid climate in some parts, and then tropical in the south. And all these come in very high UV intensity, as you can see in this diagram. Most of our UV intensities are within above 7, which is very high. And there's high UV, and there's also air pollution. These are the challenges we have in our environment. This is just to buttress what I'm saying about the maximum temperatures can be up to 11 and 12 in many parts of Nigeria, Port Harcourt, Ibadan, Kano. It's quite high. And this is one of the actual reasons why we are the color we are, because our skin has adapted to this high UV intensity over thousands of years. People who are originally from high tropical UV intensity area tend to have darker skin tones as a means of adaptation to our ambient climate. Now people can live anywhere they want on the earth, but our skin color actually tells us a story of where our ancestors kind of originated from. And so you find that around Africa, the equator, we have a lot of darker skin people. Asia, around any countries around the equator generally, the people tend to be darker skin. And when you move up to the northern hemisphere, you find that the skin color gradually, the general population skin color gradually fades off. And this is biology's way of making us adapt to our environment. In the low UV intensity areas, you need to be able to absorb more vitamin D. You need to be able to absorb more UV radiation to produce vitamin D from a lower amount of UV intensity. But for us, we need the protection to prevent against the harmful effects of UV. So that's one of the reasons why skin cancer in our environment is not as common, UV-induced skin cancer, so to speak. So it's just a natural adaptation. As you can see, the places where are light and the places where people are dark, places that have high UV intensity and places where we have dark colors kind of follow the same pattern. And so in dermatology, we use a scale often called the Fitzpatrick phototype. It's not very accurate, or people are looking for better ways to talk about skin color, but it's functional, it works. And it divides our skin types into about 6. Now, those of us in this part of the world are mostly skin Fitzpatrick's 4 to 6, mainly 5 and 6. Whereas people who are Caucasian, people who are from the northern hemisphere tend to be Fitzpatrick's 1 to 3. And so there are different features. Those of us with Fitzpatrick 5 and 6 tend to have more melanin in our skin, and we have more mature melanosomes, and we have better UV protection. But it also kind of reduces the amount of vitamin D, in low UV intensity areas, and I'll talk about that a bit later. So the skin cancer risk in darker skin types from UV is much lower compared to people with lighter skin type. Now, people with albinism are kind of like Fitzpatrick 1 because they have minimal and so they need a lot more photoprotection to prevent skin cancer. But darker skin toned individuals, they need photoprotection, but not necessarily to prevent skin cancer. So that's one thing I would like people to understand. Our Fitzpatrick 5 and 6 are most protected from ultraviolet radiation because of the high melanin content. And UV-induced, ultraviolet radiation-induced skin cancers are not common in such skin types because the melanin is doing a good job at protecting the nucleus of the cells from the UV radiation that can lead to DNA damage, which can eventually lead to skin cancer. But what happens in the darker skin tones is the UV radiation causes hyperpigmentation. And so induced hyperpigmentation is more common in darker skin tones than in lighter skin tones. And so we find that when we are exposed chronic UV damage, we may not develop UV induced skin cancers, but develop a lot of dyspigmentation, discoloration, hyperpigmentation, that is peculiar to darker skin tones. And so dark skin is not immune to UV damage, as some people believe we have Odeshi against the sun. But if you don't protect your skin from the sun, like there's excessive sun exposure, there is chronic UV damage. It may not be skin cancer, but in the other things, like we have a lot of this seborrheic keratosis, DPNs, and then if there's skin lightening, you can have damage from the skin lightening products worsened by the UV and visible light, and then also with inflammatory disorders like acne, there can be hyperpigmentation. And so these are common skin dermatohiliosis, which are abnormal skin conditions that occur due to excessive sun exposure. We tend to have hyperpigmentation, melasma, dermatosis papulosa nigra, what everybody calls skin tags in quotes on the face, the Morgan Freeman spots. Then also hypopigmentation, light patches on the lower limbs, on the extremities, is also UV induced. And then photoaging and then bleaching. Now we have skin cancer coming up in people who have bleached their skin for a very long time, but it's not very common. So in some cases, we are beginning to see patients that have skin bleaching induced skin cancers associated with skin bleaching. also with HPV. And of course, hyperpigmentation is a big problem, as Dr. Akinkupe has spoken about. So I won't talk too much about that. And you cannot successfully treat hyperpigmentation without adequate photoprotection or other photoprotective measures. So post-inflammatory hyperpigmentation, drug-induced photoaging, these are all processes that require photoprotection as part of the treatment. And most protocols for the treatment of hyperpigmentation always include photoprotection as an important integral part. And also for people doing cosmetic procedures, it's non-negotiable to use sunscreen and other forms of photoprotection after such procedures. And so in high-risk populations in our environment as well, it's important that photoprotection is used. People with vitiligo, so the depigmented patches, are more prone to sun damage and even sun-induced skin cancers. People with albinism, people with genetic conditions like xeroderma pigmentosum, people who are taking photosensitive medication, chronic skin bleaching, and people who work outdoors are all high-risk population for photoprotection, and they should take it very seriously. And so the types, we have topical, we also have oral, and oral photoprotection is becoming more common, or is being recommended more now. But we focus more on the topicals. We have two main types, the mineral sunscreen, the physical sunscreens, and the different filters. We have different types of UV filters that function in different capacities. And for the mineral filters, we have things like titanium dioxide, zinc oxide, and iron oxide, which are said to be very good for skin of color. But the challenge we have with such is they tend to be leave a heavy white cast. And so sometimes the balance between choosing the most effective sunscreen and the most cosmetically acceptable sunscreen tends to be a little bit difficult. Then we have newer organic filters that are safer, have less controversy, because some of the old filters, there's a lot of controversy about them, but the newer ones have been found to be much safer. And so the ideal sunscreen should be a broad spectrum sunscreen that covers for UVA, UVB, and especially the long UVA1, high energy visible light, and also infrared radiation, which I didn't talk about much, but infrared radiation, also the heat, has been found to trigger or worsen hyperpigmentation, especially with melasma and in darker skin tones. So a sunscreen should be non-irritant, should be stable in light, should be able to be compatible with other ingredients like antioxidants and antipigment molecules, should be lightweight, non-greasy, not the one that you use sunscreen and you'll be sweating and feel uncomfortable. The white cast is it's not very nice. We don't like looking like a ghost. And then you want to use sunscreens that are not irritants, that have low sensitization and are readily available, and affordability is also important. Now, mineral sunscreens are said to be fantastic because of the iron oxide, which is the best at preventing hyperpigmentation from visible light. And so it's particularly beneficial for darker skin type. But the cosmetic problem of it leaving such a white cast, even with tints, is a challenge. But we're getting better at finding, or formulators are getting better at getting sunscreens that are tinted to suit much darker skin types. So we're hoping they continue to tweak it. Okay, so patient education, everybody needs sunscreen. So as pharmacists, as health workers, everyone, sunscreen is important. It's more important to prevent skin cancer in lighter skin types. For darker skin types, it's important to prevent hyperpigmentation and premature aging. And you want to use a sunscreen that's at least SPF 30, has UVA protection, PA+++, has some visible light protection, and even infrared protection. Newer filters are found to be effective at this. How much sunscreen do we use? 3 fingers for the face and neck. And sunscreen is meant to be reapplied every 2 hours when you're outdoors. If you are indoor, you don't need to reapply so frequently. You can maybe reapply once. But if you're outdoors, it's more effective to apply. And then integrate topical antioxidants, and even oral antioxidants are being recommended. And then hyperpigmentation is important for managing, sunscreens are important for managing hyperpigmentation. So this is just a summary. I won't go through this to save time. Now we're finding that sunscreen use in Africa remains low, but is increasing, especially in educated and social media survey. We did a survey that's been published recently that showed that about 64% of digitally active people were using sunscreen. Maybe not as good as they should, but they were trying to use some kind of sunscreen, which is good. And the barriers, but most previous studies had showed something like 10%, less than 10%. Well, with social media, I think more people are getting to know that sunscreen can be beneficial. And of course, there are barriers, cost. Some people feel we don't need it as dark skinned people. The formulations are not compatible. And then some people are scared about things like they talk about online, the fear mongering about endocrine disruption, vitamin D cancer, and all those things. So sunscreen can also be useful, and sun protection in general, to combat skin bleaching. We have a high prevalence of skin bleaching in Nigeria. And one of the main reasons why, from the studies we've done, have shown that people use skin bleaching cream to treat hyperpigmentation, and then they go down the rabbit hole of bleaching for a long time. So encouraging proper photoprotection can reduce this tendency to want to treat hyperpigmentation, because it can reduce UV-induced hyperpigmentation, and it provides an alternative pathway to meeting aesthetic goals. And so integrating regular photoprotection into skincare regimens could reduce the demand for skin bleaching. So there are some controversies about sunscreen, which we hear about all the time. It disrupts hormones, but a lot of those studies were the rats and they were not humans. The rats were given sunscreen to eat. Nobody eats their drinks bottles of sunscreen, and it was large amounts. And so in topical application, this endocrine disruption was not shown to occur. And sunscreens do not cause cancer. There's the issue of benzene. Benzene, some older filters may have contained benzophenone and benzene, but these are no longer being used. Newer filters that are available are less problematic. And sunscreen has not been found to reduce vitamin D. I always recommend people still have at least 20 minutes daily of sun exposure for their vitamin D synthesis. And if people who are darker skin live in temperate regions, they should supplement, because even the available ambient UV is not enough to produce enough vitamin D. And so that's why we have a lot of vitamin D deficiency in people who live in temperate regions. So some sun is still fine. Don't live like a vampire, but photoprotect so that you don't get excessive sun exposure. And then physical versus chemical sunscreens, which one is better? It's the one you will use. They both work, but if you have a physical sunscreen that makes you look like a ghost and you don't use it, then it's not helpful. So if you have a chemical sunscreen that is cosmetically compatible and you use it, it's functional, then that's the best one that you should use. And general advice, just remember, cleansing with pH balanced cleansers, moisturizing, the 3-minute rule, moisturize 3 minutes after bathing. Sun protection includes seeking shade, sunscreens, hats, and, not just sunscreens, eating healthily, drinking adequate water, getting adequate sleep, and then consulting a dermatologist for skin concerns. This is very important. And so the take homes here are darker skin tones have natural photoprotection, but they are insufficient for UV-induced pigmentation and photoaging, especially in high UV climates like ours. And sunscreen use is not only for skin cancer prevention, it also prevents premature photoaging and hyperpigmentation. It can be used to combat some skin bleaching tendencies and the adverse effects of skin bleaching. And the right sunscreen to use should be broad spectrum, covering UVA, UVB, visible light, and should be combined with antioxidants. And, sometimes you can use oral antioxidants and sunscreen for best effects. 2 to 3 fingers for the face and neck, and you reapply every 2 hours when you're outdoors, or once or twice daily if you're indoors. And sun protection should be high priority for people in high-risk groups. So thank you very much for listening. I'm available for the questions, and please follow me on social media, where I always try to educate people about their skin health. Thank you.
Well, thank you very much, Dr. Cole. That's our social media expert. So she has told you can also meet her outside this platform. Thank you very much for that. I think time has been well spent. Maybe we'll take Sophie's presentation before we open for questions and answers. Dr. Cole spoke about, Sophie, if you're ready, please.
Yes. So I'm going to share my screen. Okay. So thank you very much, Dr. McCarthy, Dr. Ayesha, and Dr. Cole for your presentation, and thank you very much to the NAD for inviting us to participate to this community webinar. Today I will speak about products, about management of pigmentary disorders and photoprotection. And let's start with hyperpigmentation. You have to know that until very recently, there was no data regarding the hyperpigmentation and pigmentary disorder around the world. So in the end of 2022 to beginning of 2023, La Roche-Posay performed a survey around the world with 48,000 interviews in 34 countries, and in Africa we had Nigeria and South Africa, Ivory Coast, and Kenya. In Nigeria, 1,000 people were interviewed. So thanks to this survey, we were able to know if people were declaring to suffer from a pigmentation disorder and what was the impact of this pigmentation disorder on their quality of life. So as you can see here, in Nigeria, 59% of the people declared to suffer from a pigmentation disorder. And it's much more than in the world, because in the world it's 50% of people. And you can see that regarding PIH, the number of people in Nigeria is 29%. So it's 2 times more than in the world. And so PIH, as Dr. Cole and Dr. Ayesha said, it's very often linked to acne, for example. And as Dr. Ayesha said, hyperpigmentation or pigmentation disorder have a big impact on quality of life. This survey, we asked two people what is the impact of this pigmentary disorder on their quality of life. And you can see that for 36% of people in Nigeria, they declare that this pigmentation disorder has a very or extremely large effect on their life. So thanks to this survey, we know we have data regarding the pigmentation disorder in Nigeria and the impact of pigmentary disorder in the quality of life. So it's very important to have this in mind when you have to give an advice to people, because you don't treat only the skin, you treat also the life of these people. So in order to manage these pigmentation disorders, at La Roche-Posay, we have a solution that is Mela-B3 serum to manage hyperpigmentation with an efficient dermocosmetic with proven efficacy without side effects. So very well tolerated, it's very important. So this product, it's a comprehensive formula because we have our new active ingredient, melasyl. This melasyl is very efficient and without side effects, so it's very important to have this in mind. But we have also a lot of different active ingredients in order to have an anti-oxidation effect, anti-inflammation, etc. So all that you need, the skin need, in order to manage pigmentation disorders. And what is important with this product is that we have something very unique. We have a clinical study in Senegal with this product, so on African skin in Africa. And this is very special because very often you have a clinical study in Europe or in USA, but we know that it's important to test and to have data on the product in your condition, in your UV exposure, as Dr. Cole said. And so we have a study in Senegal. So this study, we had a very good results. And we had a poster at IMCAS, so this is an international congress, and also in ASDV, it's the congress of all the dermatologists in Africa. So we had two groups, one group with melasma, and you can see that the phototypes was from 3 to 6, and one group with PIH, and you can see that we had phototypes from 3 to 6 also. So mostly dark skin in order to evaluate the efficacy of melabis-3 serum on melasma and on PIH. And you can see that we had very good results. With on melasma, we had a decrease of the score that we use to validate the efficacy, and we have a decrease of 63% after 3 months of the color and the intensity of the melasma. So this is very interesting. And also on PIH, so the dark spot that we have after acne, we have a decrease of 26% after 3 months. And you can see that we have an efficacy just after 1 month. So this is very quick in order to have visible results. And we have a picture. This is one case of melasma, and this woman, she had a decrease of 87% of her melasma. So this is very impressive. And this subject was suffering from PIH, and we have also a decrease of the color of the dark spots on the face. So melabis-3 serum has a very strong efficacy and very well tolerated, and the efficacy and the tolerance were validated in randomized controlled trials. You know that La Roche-Posay is very proud to have a strong clinical trials and clinical studies in order to validate the efficacy and the tolerance of the product. So we know that we have an efficacy on PIH, on melasma, from 16 years old. And in order to manage hyperpigmentation, you need to have a routine, you have to have a regimen. And so you can advise a good cleanser, smooth, gentle cleanser. As Dr. Cole and Dr. Ayesha said, we need to have a gentle care in order to take care of the skin without irritation. So the cleanser is melabis-3 micropeeling gel. After, in order to correct, to manage dark spot or pigmentation disorder, it's melabis-3 serum 2 times a day from 16 years old. And after, of course, you need a photo protection. And we have Antelios UV-Immune 400, and we will see it just now. Because to fight hyperpigmentation disorders, photo protection is mandatory. It's very important because we know that UV, they will create hyperpigmentation. So as Dr. Cole explained, we have UVA, UVB, but also visible light and infrared that comes from the sun. And they are all responsible of damage in the skin, and especially UVA1, so the ultra long UVA, and visible light, they have an impact on pigmentation. So you can see that on this study, a published study in the British Journal of Dermatology, that because of UVA and visible light, we have an increase of the pigmentation. So it's very important to choose the good photoprotection in order to protect again this pigmentation induced by UVA and visible light. So regarding UVA, it's very easy, I would say, because we are very strong in this protection thanks to the Mexoryl 400. It's a filter from L'Oréal and very good in ultra long UVA. And after, the challenge is for visible light. Why? Because, as Dr. Cole said, the best until now to protect against visible light is the pigments or iron oxides, and they are tinted. So it's a challenge, especially for darker phototypes, to find the good shade for the skin. So the idea is to search and to find actives in order to create photoprotection non-tinted. So in order to reach the patient's satisfaction. So we conducted a study to compare UVMune 400 anti-dark spots, a non-tinted formula, and a UVMune 400 tinted formula. So you can see in the purple, you have the non-tinted formula with melasyl, our new active ingredients. And in the brown line, you have the tinted formula. And you can see that when you put visible light on the skin, we have the same efficacy with UVMune anti-dark spot product, non-tinted, and UVMune 400 tinted formula. That means that we have the similar efficacy with a non-tinted cream compared to a tinted cream. So this is very interesting, especially for darker phototypes. So this is our new product, and we are very proud because it will be a good solution in order to take care of protection against visible light induced pigmentation. So Antelios UVMune 400 anti-dark spot fluid is as efficient as a tinted sunscreen to protect against ultra-long UVA. It contains melasyl to manage pigmentary disorders, very interesting, and it has a validated effect on visible light-induced pigmentation. On this range of Antelios, you have 3 products, mainly prescribed by the dermatologist. So the Antelios UV-Immune Fluid for normal to dry skin. For combination to oily skin, we have Antelios UV-Immune 400 Oil Control Fluid, SPF 50+, of course. And for dark spots, for photo protection, especially for people suffering from pigmentation disorder, we have the new Antelios UV-Immune 400 Anti-Dark Spot Fluid. So in order to manage hyperpigmentation disorder, we have this combo, this regimen with Melabis serum and Antelios UV-Immune 400 Anti-Dark Spot Fluid. Thank you very much.
Thank you so much, Anne-Sophie, for the presentation. That was wonderful. So thank you very much. I think time has been well spent. Dr. Ko spoke extensively about sunscreen, why we needed to do it, how we need to use the sunscreens, both for photo protection as well as to reduce the effects of skin aging. And then, of course, for management of post-inflammatory hyperpigmentation, we also need to apply sunscreens for maximum effect. And I think it couldn't be better than the product presentation, where we were giving examples of the products that we can actually use for this for management of hyperpigmentation. And Sophie spoke about MLIB3, as well as that's for management for anti-dark spot management, which also includes SPF 50. Oh, sorry, the MLIB3 for the hyperpigmentation, as well as the anti-Helios UV Immune 400 with SPF 50. And I think they have the different types, the tinted and the non-tinted. And Dr. Cole just spoke about the differences between tinted and non-tinted and what have you. So I think these are the products, and I think we'll also have recordings on our YouTube channels for people to go back and go through and both go through carefully. So we have questions here. Let me start with those on the Zoom link by some of our members. Yes, there's a question here. Yes, by Dr. Shakirat. She was going to ask about thoughts on using products that we already know to help with hyperpigmentation mildly early enough, because most black skins will develop these age spots or some form of hyperpigmentation. So example, incorporating them into usual routine once you're a certain age like 40 and above, and also retreating sunscreen use. I think this is basically maybe a comment. Okay, sorry, Dr. Aisha has already answered her, I believe. The other question that I saw there, I saw two questions there. Okay, some questions have been answered, so I don't know whether Dr. Akinkube and Dr. Cole can respond, because it's like they've been answering some of these questions on the chat box. Then I'll just mention those that are also on the YouTube channel for us. So Dr. Akinkube, can you go first? You seem to have been answering your questions online. I was just seeing the later ones.
Yes, she's answered most of the questions in the chat box.
Okay,
I don't
maybe
know
you
if there are
just
any
mention one
questions
or
on the
two
YouTube.
things. Yeah, okay, so let me just go to the YouTube. There seems to be, well, questions, but I don't know. It's like, well, let me just read them out, then you can give your appropriate
Yeah,
response.
somebody is asking about sunscreen. Well, two questions came on sunscreen in children. And it's typically recommended from 6 months to 1 year and above. We don't recommend sunscreen in children under 6 months. But from 6 months, if they can, their children formulations. And what is recommended is a more mineral filters for young children. Um, but yes, children can apply sunscreen from the age of 6 months. I know there are recommendations from the um, American Pediatric Association that they can be used in children, but for children from the age of 6 months.
So, some of the questions that we have here, what do you suggest for scalp hyperpigmentation from endogenous ochronosis? And let me just read them out. What's the best product for treatment for seborrheic dermatitis? Then at what age would an infant with congenital nevus benefit from laser therapy? Thank you for your excellent presentation, Dr. Akinkube. My question is, what recommendations for the black spots seen after bouts of rashes or bites? Okay, the others are thanking her. Then the other question, what is your stance on the use of IV antioxidants for skincare in Nigerian spas and wellness centers? Then finally, at what age can an individual start using sunscreens? So I think for the both of you, but Dr. Akinkube seems to have more. So Dr. Cole, I think your own is at what age? I think you just answered it. At what age can an individual start using sunscreens?
Yes, so typically, like I mentioned, we usually want from the age of 6 months, and usually if they're going to be outdoors, when they're indoors, may not need to. We're going to be outdoors on the beach, for instance, on outdoor trip, you want to apply sunscreen. But with children, we tend to want to focus more on clothing, hats, but then of course the exposed areas after they're wearing the wide brim hat or clothing to cover most of their body, then on the face, on the hands, you may want to put some sunscreen on those areas. Okay, considering the question on seborrheic dermatitis, depends on the extent, but you would want a topical antifungal, usually a cream, the shampoo, and then oral antifungal agents. Of course, after treatment, you could still have post-inflammatory hypo or hyperpigmentation, but you need to also, as you're giving the treatment, you also need to manage their expectations, because SD, when it is bad and extensive, can be quite difficult to treat, but it is something that is treatable and preventable. And then you might also need to use prophylactic treatment as well. Then
IV antioxidants in skincare in Nigerian spas and wellness centers.
Well, as dermatologists, we don't believe or we don't think there's enough evidence yet to the benefits, whether the benefits of IV antioxidants outweigh the risks and complications that probably, even in a medical setting, not to talk of in a spa where you may not have licensed medical practitioners administering these IV infusions. So there's high risk of infection, pulmonary embolism. There's risk of also the formulations being contaminated with harmful substances. I know we've had a case report. Dr. Eniboko in Ibadan did that a couple of years back of a patient that almost had like what looked like a pulmonary embolism following IV glutathione infusions. So we don't typically, and there isn't enough evidence to state that they're useful. And most people who use these products use them as a form of skin lightening or skin bleaching, which we don't encourage. So as of for now, the evidence for these infusions or antioxidant infusions is not, there isn't much evidence. There still needs to be a lot of research. And I would advise anybody who wants to have that kind of procedure to go to a place they're licensed medical doctors and not in beauty spas where people do not have the training or the expertise for invasive procedures like intravenous infusions.
And there's a question about the pigmentation from insect bites.
Yes,
the first thing also will be to prevent them. This happens commonly in atopic individuals, and you have a hypersensitive reaction to the bites, which we call papilla urticaria. So first things first is to prevent the bites. So you use pop socks for older, because first of all, when they're above over 18, 16 to 22, that kind of age anyway, use pop socks. But otherwise, we also say use insect repellents. We have a common one that's made locally, Odomos, and there are other insect repellents on the market. It's not just mosquitoes. The first question they'll say to you is, it's not mosquitoes, it's sandflies and all those, mites. They also bite, and it's recurrent. So every time you are bitten again, you have a hypersensitivity reaction. So you find all the other ones to start to itch. So you want to stop them itching, you want to cancel them. You also want to ensure they have short nails. We use hydrocortisone for a short period when the bite just, has just occurred. Then if there's a break in continuity of the skin, we can use a topical antibiotic. But mostly we try and talk about prevention. And then we can start to work on the depigmenting agents, depending on the age, and letting it sort of heal itself naturally. And then, we start to use some of them. There are various things in the market. There's kojic acids, some creams with kojic acid. There's some with Melasil. There's another. There are quite a few, there are quite a few that you can use.
And then alpha hydroxy acid.
Yes, that's right. As well.
Okay, so thank you very
Most
much for
important
these
is talk about
responses. Okay. And Sophie, you have a question there. I noticed you answered one of the other questions, but you avoided this. So
No, I will. I will.
Dr. Olarinwaju, yes, I think you've
for
read it. What are you doing to help patients with hyperpigmentation in Nigeria? Because pricing and the volume has been a major complaint from the patients and a big limitation to its use despite its usefulness. The products must be pocket friendly, and we must discourage the use of over-the-counter bleaching agents.
Yes. So thank you for this question, because it's a very important question, and you are totally right. We were at the ASDV Congress in April, and it's the same problem in all the countries in Africa for drugs and for dermocosmetics. So every country is working on this subject in order to decrease the tax, etc. Because it's not just because of us, but it's also because of importation tax. But we are totally aware of this, and we are totally agree that if we have too expensive safe product, it's difficult to advise and to prescribe these products for you. So thank you very much. This is important to have this in mind, and we want to work closely with healthcare professional to help to create a confidence with our products and to create a good environment for this product. But I agree, it's something very important in the everyday life. And there was another question regarding adolescents on Melabis-3 or the cleanser. Usually we advise Melabis-3 serum and the range from 16 years old in order to, for example, to help with a dark spot linked to acne, with PIH linked to acne. So adolescent, it's okay from 16 years old. And there is another question. My question to Mrs. Sophie, who are the author of the